How keto diet can help reverse type 2 diabetes. Type 2 diabetes is normally defined as a chronic and progressive condition resulting from the insufficient production of natural insulin, causing high blood sugar in many patients. Upon receiving an official diagnosis, most patients are told they will need to take medication for life and that there is no cure for diabetes. However, many scientists, clinicians and dietitians disagree with this prognosis, claiming that diets such as the ketogenic keto diet have the potential to support the reversal of type 2 diabetes. What is diabetes? Diabetes is a disease where blood glucose levels remain elevated. Having high blood glucose levels can cause additional health problems over time, including cardiovascular disease, kidney disease, vision impairment, peripheral nerve damage and even depression. There are two main types of diabetes, type 1 and type 2. Type 2 is by far more common, accounting for 90% of all diabetes cases worldwide. In this type, the body does not make or does not use insulin well. It can happen to anyone but is more common in people over the age of 40, those who are overweight and inactive, those with a family history of diabetes and patients whose diets consist mainly of refined carbohydrates. What is the keto diet? The ketogenic diet, keto diet for short, is a high-fat, low-carb diet. The diet was originally developed in the 1920s as a treatment for epilepsy. However, it has since gained the attention of scientists and the public as a possible answer to a wide range of ailments, diabetes included. The keto diet involves restricting carbohydrates usually to less than 50 grams per day. The majority of a person's calories on this diet should come from fat, while protein intake should remain moderate. Eating in this manner puts the body in a natural metabolic state called ketosis, from which the diet got its name. When someone is in ketosis, they have high levels of acidic molecules called ketones in their blood and tissue. In ketosis, ketones function as fuel alternatives to glucose and can help diabetes patients who are unable to utilize glucose effectively. Clinician Today Shutterstock How Keto Diet Can Help Reverse Type 2 Diabetes Lifestyle Ketogenic Keto Diet Diabetes Ketosis versus ketoacidosis, what's the difference? Many diabetes patients are familiar with ketoacidosis, also called diabetic ketoacidosis, and they may confuse this condition with ketosis. Even medical experts often confuse these two terms, however they are not one and the same. Ketosis is a natural and healthy physiological reaction to a lack of carbohydrates in the diet. It is an evolutionary adaptation that has helped humans survive periods of food scarcity and starvation. There are well-documented health benefits of being in ketosis. Ketoacidosis, on the other hand, is a complication of poorly managed diabetes. It results in uncontrolled production of ketone bodies that can change the pH of the blood, which can prove fatal. Ketoacidosis is more common with type 1 diabetes rather than type